Hello, I'm Dr. Sugar, your internet doctor, here to give you your dose of medical inspiration for the day. Thanks for watching. Our topic is bronchitis. So let's get started, shall we? On one busy day, you get a call from your baby's school that he's not feeling well and he's coughing and he feels kind of short of breath, and you're asked to come and pick up your child and take them to the doctor. You're in a panic and you rush back to the school where you left him this morning to find that he's sitting on the side of the chair in discomfort and coughing out these big blobs of phlegm and mucus, and he's taking short, forceful breaths and has a fever. This could be an acute attack of respiratory disease called bronchitis. Now, don't get the idea that bronchitis is just an illness of children, because it's definitely not. We can all get bronchitis. And even though this word bronchitis sounds like it's a very significant thing, I want you to be aware that bronchitis is just a fancy doctor word that means chest cold. So whenever the doctor says you have bronchitis, really that just means that you have a cold that has settled in your chest. Bronchitis is an inflammation of the main air passages to your lungs. These air passages are called bronchi or bronchi. And bronchitis may be short-lived, which is called acute bronchitis, or it can be chronic, which is called chronic bronchitis, meaning that it lasts a long time and it often recurs. Bronchitis can cause a cough, shortness of breath, and chest tightness, and the cough will often bring up some yellow-green mucus. Yeah, that is like one of the grossest things for me as a doctor. People always think blood is bad. For me, it's the phlegm that gets me, just thinking about it. Okay, so back to our topic, bronchitis. It can be acute and it can be chronic. So let's talk about the differences. Acute bronchitis is often caused by the same viruses that cause colds. Remember, I said it's just a chest cold. It usually starts as a sore throat, a runny nose, or even a sinus infection, but then it spreads down into your airways. It can cause a lingering dry cough, but it usually goes away on its own. Because it's caused by a virus, all that's usually needed is supportive care. So most times when you have bronchitis, an antibiotic is of no benefit whatsoever because it's caused by a virus. However, occasionally you may get another infection on top of this. This is called a secondary infection, like a bacterial infection in the airways. And this means that bacteria infect the airways in addition to the virus that was causing the chest cold to begin with. In those cases, an antibiotic will be given, but otherwise it won't. And we'll talk about treatment more in the next section of the video. So, okay, that's acute bronchitis. Let's talk about chronic bronchitis now. This is a long-term condition. It's one type of chronic obstructive pulmonary disease. Now, you may be more familiar with the other member of chronic obstructive pulmonary disease, which is emphysema. So COPD has two members of it. One is chronic bronchitis, and the other is emphysema. Emphysema is a more familiar word, I think, to most people. In chronic bronchitis, the inflamed bronchi produce a lot of mucus. This leads to cough and difficulty getting air in and getting air out of the lungs. To be diagnosed with chronic bronchitis, you must have a cough with mucus most days of the month for at least 3 months duration. As the condition gets worse, you can become increasingly short of breath, you can have difficulty walking or exerting yourself physically, and you may need supplemental oxygen on a regular basis. Cigarette smoke, including long-term exposure to secondhand smoke, is the main cause of chronic bronchitis. The severity of the disease often relates to how much you smoked or how long you are exposed to the smoke. Breathing in other fumes and dust over a long period of time may also cause chronic bronchitis. Treatment will help your symptoms, but chronic bronchitis is a long-term condition that keeps coming back and usually will never go away completely. I'm Dr. Sugar, and I want to invite you to join me for part 2 of my medical inspiration video series on understanding bronchitis. In the next section, you will learn the symptoms of bronchitis and what may happen at your doctor's visit, so make sure to check it out, and I'll see you there.